I'm hearing a lot about the worries of either people who are employed by the government, by the federal government, or our spouses, or have relatives or loved ones. So across the board, I'm hearing about it in my work.
And it's interesting because federal employees, usually when you work for the federal government, it's stable. That's
Yes.
what, that's been the draw.
That's right.
But now that's changed.
Yes.
What are you hearing? What are some of the fears?
I'm hearing a lot of fears about the unpredictability and the suddenness of the layoffs, and the fact that they're coming with no warning. They aren't based on anything that's about performance, and that people are suddenly sideswiped. They have no income, their benefits are gone, and so all of that stability that they've relied on, or their families have relied on, are just gone, and they just can't predict. Or there's a lot of fears of that coming if someone hasn't lost their job yet or been laid off.
That type of loss almost seems like a death in the family.
Yes, it can feel incredibly traumatic and significant. And so I think one of the things that we can do that's most important is to kind of name it for what it is. So someone had said, well, I'm really sorry that you're stressed about that. And I thought, it's more of a devastation. That's a devastation that's happening, more like if you had a natural disaster, like a firefight or a fire or an earthquake. Like, that's a natural response to that. The people are really lost and panicking, numb, in shock, and don't know what to do or where to turn. And so their reactions make sense for what's going on, and how we can help them is important.
So if somebody, personally, they lost a job, and they don't know what to do, there could be almost like you can't move forward, you can't move back, you're just stuck.
Yes.
What should somebody do in that point?
Well, I think it's useful to just recognize that that's common. It's a common reaction, and to first just get some support and talk through it, maybe with loved ones or friends or other people who are going through it. There are resources of a variety of things that are going on in the community to help people, and trying to access those resources is useful because people are worried about their livelihood, whether they can pay bills, whether they'll be able to pay for their rent or their mortgage. So there's a real pragmatism about it. And also just letting them have their reactions, being able to talk with someone or give them an opportunity to get some support from people is really useful. And know that people are going to be very upset. They might have difficulty sleeping, concentrating, they may not have an appetite, they may feel really panicked, they may feel really angry and not know what to do with those reactions. Those are normal, but I think the more we can offer people a chance to talk, ways that they might be able to get some help for any of the things they're dealing with is important.
Anger, panic,
yes.
Frustration, those are normal, as you're saying.
Yes.
When does it become, or what point does it become where you need to get help? It's been too late. Is there like a time period where you have your time to be angry, upset, but then you need to move past those emotions?
Right. Well, I think with something like this, any help will be important. So help might mean community resources, help might mean financial. In terms of psychotherapy or mental health services, this is the type of thing where help is probably useful of some sort, whether it's in a community or with a group or a peer group or seeing a therapist, if that's possible. Certainly people run into the pragmatism of, if they don't have any more health insurance, how do they find a therapist that they can pay for? And the costs become very significant.
If someone has been seeing a therapist and then now they lose their health
Yes.
insurance.
Right, that's happening, yes.
That is happening.
Yes, that is happening.
What do they do? How do they it's like stopping medication
Exactly.
right away.
That's right.
What do you do?
That's right. And I don't think we know. I think that I know that for me, I've had conversations with my clients about what we will do if that happens, or when that happens, how we will adjust, what we can possibly do moving forward. I think it really depends, and none of us know what's going on. Will they get reinstated? Will they get their benefits back? Everything is so chaotic and unpredictable right now. But assuming that someone has lost their job entirely, the therapist would hopefully try to see them a little bit, or at least get them connected to something else. But the therapeutic relationship is not this disposable thing where you just slot in with someone else, ideally, although pragmatically that may be what happens. So it's really a very hard time for people's mental health and treatment and services. I don't know that I know much more than anyone else. We're all trying to figure it out and respond. I think for therapists, like many other professionals, we care about people and we want them to be doing as well as they can. So I'm trying to be as flexible as I can around payment whenever I'm finding that with my clients. But we're all feeling it. If anyone who works with a federal worker is feeling it in some way, and anyone with a federal worker in their lives or a federal worker themselves, we're all feeling it in different ways. Yeah, it's really scary. Yeah.
Some of these people, they're getting called back to work.
Yes.
And then it's, okay, I'm getting called back to a job I was let go of.
Right.
Am I going to get let go of a second time?
Right.
How do people deal with that?
It's like a whiplash. I don't think it's obviously not ideal. I don't know. I don't know that it's a stretch to say that anyone is working well under these conditions in the federal government right now, because everyone is scared, everyone is on edge, everyone is afraid that they don't account for something, they're going to be let go without any warning or not allowed back into the building. The short notice or no notice has been one of the features of this recent set of firings. So for someone who's then brought back quickly, I don't know that the pressure of that is really going to help them do their work. They might be able to move back into their work, but I can't imagine that they would be able to rest and actually focus and concentrate, because what would prevent them from being let go again on a whim, seemingly unpredictably? It's really not ideal. In fact, really detrimental for the work and for the person, certainly.
How do you, you know, I'm kind of on the outside looking in. It's like, how do I help this person?
Right. Well, generally, I find that it's useful to put things in terms of I language. So I'm really scared. I'm really angry. I feel powerless. It helps me when I'm angry or if I'm upset, because I'm not generally putting that on someone else, although I'm not the person who's causing this situation, these conditions, right? People are doing this and putting people in this position. And many people have feelings about that. I have feelings about that. So much of the suffering could be prevented and avoided if people were treated better. Cuts happen when administrations change, but this whole process of sudden and across the board is really inhumane. And people are suffering because of it. There's not a way that it's taking care of people to, maybe if things are getting trimmed, to then exit, find a job. That's not what's happening, and everyone's reacting.
Why does that make a difference of how someone's going to be let go? Why does it matter the tone, the wording? Why is that important to somebody?
Right. Well, how we're treated often affects how we interpret something and how we feel about what happens. So if someone says, hey, I value the work you've been doing, and I know that you've been working hard. However, as we're looking across the board, we're trying to eliminate 5 or 10% of the workforce, and this position is one that we're maybe going to combine with another. And so it's really the positions. It's not about you or your work, or that you're someone doing inefficient work. That's really insulting, actually, and dehumanizing. But more, and they might have some time to really find a job. But the kind of sweeping, really inhumane way of treating people, where they have no notice at all. There's nothing around performance deficits or concerns. That's all. None of that has been happening. And so there's obviously questions of whether this is even legal treatment. I can't speak to that, but certainly it's not humane, and people are suffering, and people are terrified about either if it will happen to them, or if it has, how will they survive financially and emotionally. Yeah.
Do you worry that this is going to create long-term mental health impacts coming on the heels of a pandemic where the mental health crisis just shot up exponentially?
I do. I worry about, gosh, I've been thinking so much in the short term when we do in a crisis. So if there's a forest fire, we're thinking about getting out, getting people safe as much as we can, or getting ourselves safe in an imminent threat and crisis. So stepping back, yes, there's going to be damage from this, and it's hard to know how. I don't know, but I do. How could something this sweeping and this damaging not have a long-term impact on people? Of course it will, but it's hard. It's too hard to know anything right now, let alone what the impact will be, other than people are being harmed, and it's hard to know how to manage this. It's overwhelming. Yeah.
let's say somebody gets a new job, maybe not in the federal government, but let's say in the local government.
Yes.
I would assume there would be some trust issues there.
Yes. Yes.
Like any relationship.
That's right.
How do you start to trust your employer again?
Exactly.
Can you?
Right. It's hard to know. I think there's some kind of out of the frying pan, are you going into the fire type situation? Like, so for many federal employees, there is at least I've spoken with people who have a desire to leave this environment because it feels really unsafe and dangerous to them. And so if someone were able to get a job outside of the government as a current federal employee or one who has been recently let go, there may be relief that they're not at least dealing with this. And in fact, I've heard people say who have been terminated, well, at least it's done now. At least it's known. I'm not kind of in this unknown place. So that, you're out of that situation. And then you're not quite sure what your employer, how steady that is. It probably really depends on the employer, where their kind of financial support comes from, how they treat people at a probationary status. And I can't speak to the economics and the economy effects of here. I just can't even imagine how that would then impact different jobs. But I think there'd be a lot of uncertainty and trepidation and fears that they could lose their job again. So it's really hard to know how the ripple effects of this on a large scale will then affect individual people as they may hopefully find new jobs.
Do you think maybe in like 10 years we're going to look back and be like, man, we were in the thick of it? Do you think this is going to be a moment in history?
I do. It feels like a time of great upheaval. It's hard to know what institutions and structures will survive once we get past it or through it. Certainly survival is maybe the most important part right now for many people. And once we look back, I don't know what will still exist, what institutions, how we will all be faring in terms of our mental health. But I do think this is a particular moment in time that will be a marker. In fact, I've even heard people say, I myself have said, before and after. It feels like that to me. As much as I know any more than anyone else, I don't. But it feels very significant. And I think particularly there is a way that is unique in this area, being in D.C., but even if I lived not in D.C., I would probably be feeling that. Just the federal government piece is very strong here, but there are strong sweeping changes in many areas of people's lives all across the United States right now that are very impactful. So yeah, I think it's a significant time.
As Mr. Rogers says, look for the helpers.
Yes, thank you. Yes.
So where are you looking? Where are the helpers right now?
Yes. Well, I think our community, and so where we may have a neighbor or a friend, it's important that people ask, hey, you're connected with the federal government. Your spouse works for the federal government. How are you doing? You work for the federal government. If you ever want to talk, I'm here. You may not want to. If you're reaching out to people is crucial. Having community, having friends for emotional support, maybe for support around resources, whether that's food, I don't know. But I think that piece is going to be what saves us. Really trying to lean on each other, because this is who we have to turn to is ourselves, our communities. And then again, there are resources. I'm aware particularly of the Arlington Library as a phenomenal resource, but there are others, there are different community activities and events that are popping up in response to this. I'm most aware of the Arlington Public Library, but many that I think that's how we're going to get through, is being there for each other and checking in with each other around this particular thing that's happening for federal employees, but there are lots of things going on in our country right now. That's not the only one. I think for many of us, we've invested in our work. It's how we spend a lot of our time during the week, and we may have done a lot of education and training depending on what work we're doing. And so to suddenly have to shift, for many people, it can be how we spend our time, how we see ourselves, what we see as our identity or our purpose, can really turn on its heels, and we find ourselves wondering, what am I doing? Am I qualified? Do I even want to be doing this? I may need to do this to have a paycheck so that I can afford, my housing and my food and people who may be dependent on me. So I think focusing on then the practicalities has a place, but people may feel very lost and very depressed and down in terms of what they're doing, especially if they loved what they do or liked what they did or were invested in it before. Yeah.
It's very American to have your identity connected to your job.
Yes, it is.
It's very American.
Yes.
So that's going to be something that's ripped away from somebody.
Yes, it will. And many people I know who work for the federal government and many places not only really care about their work and have trained and worked for years in their field. So yeah, I think for many people it's going to be turbulent and an upheaval, and it's an opportunity to see what else you can focus on to give you purpose. So it may be your relationships with other people, what you do in your community, other activities that you find fulfilling, but that won't make that any less of a loss or a kind of a ripping away.
So to fill that void, then maybe when you can, look to see where you can put your attention.
That's
Don't
right.
kind of say like, okay, well, I am a mom, so let me focus more on my daughter.
Yes,
okay,
that's right.
Okay.
I think right now it's a crisis. So for many of us, it's a matter of getting what we need and getting security and safety, having enough money to be able to pay the bills or pay for housing, having insurance. And then typically after a crisis, there's some of those other questions. Okay, so who am I? What am I doing? Where can I put my energy and my attention now that we at least hopefully can cover the costs and people have what they need. But people may feel great loss in terms of the work that they've done if they're no longer able to find work in that field or in their career.
If I have a friend who
Yes.
lost their job, what could I do
Yes.
to help?
Well, I would offer to talk to them and give them an opportunity to talk, and if they start to talk about a lot of mental health concerns, encourage them to try to talk to someone who's a professional, but that may be hard to do. It's hard to access. But certainly having support of a kind space that's supportive will help. They might need to go do some things where they feel some sense of agency, whether that's going and taking a walk. Some of the things that we've heard about that are good self-care won't take away what has happened, but it's more of a way of coping and trying to stabilize. There's so much we're trying to stabilize right now. Some of us multiple times a day because we are in so much instability. So, and also I'm aware that some of these things I'm saying will fall short. I won't have answers to everything, and none of us do. Yeah, but how we meet each other I think is crucial. So truly that's what I think will help us get through. Yeah.